Dear students, let us start learning various scenario-based questions that can be asked in physiology with the explanation. Mr. GH, aged 55 years, visits physician complaining of severe chest pain radiating to his left arm, neck and shoulder. He also complains of severe sweating, nausea and vomiting. Examination shows his BP 160 by 100 mm of mercury. ECG was done which shows ST segment elevation. What is the probable diagnosis? This is a typical case of myocardial infarction known as MI, which is also one of the ischemic heart disease, that is IHD. So to understand the pathophysiology of ischemic heart disease, you need to know some of the features of coronary circulation. So heart is supplied by dominant arteries, that is right and left coronary arteries. They are end arteries with no collaterals. Normally, heart receives 250 ml of blood flow for every 1 minute, and it has high oxygen consumption, that is for every 100 ml of blood flows through it, oxygen which will be consumed will be around 6 ml. Heart is different from other tissue in that it utilizes fatty acid mainly as source of energy rather than glucose. And coronary blood flow shows phasic blood flow. The meaning of phasic blood flow is the left ventricle receives its blood supply mainly during diastole phase of cardiac cycle and not during systole. This is because of the pressure gradient which is seen in between the left ventricle and the coronary arteries and aorta. Whereas right ventricle receives continuous blood flow during both systole and diastole phase of the cardiac cycle. You also need to understand the regulation of coronary blood flow to understand the myocardial infarction. Coronary blood flow shows autoregulation. The meaning is, even if the mean blood pressure varies between 75 to 170 mm of mercury, the blood flow to the heart will almost remain constant. So the coronary blood flow is mainly regulated by various metabolites like carbon dioxide, hydrogen ions, lactate, potassium and adenosine. The meaning is, if the heart is working more, there will be lot of metabolites produced which I mentioned before, and these metabolites are powerful vasodilators which will tries to increase the blood flow to the heart. So the blood flow to the heart is mainly regulated by metabolic regulation. Neural regulation have a very minimal role to regulate the coronary blood flow. So heart is supplied by both sympathetic and parasympathetic. So the sympathetic direct effect will be reduction in the coronary blood flow, whereas indirect effect will be increase in the coronary blood flow. Now let us try to understand the pathophysiology of ischemic heart disease or cardiovascular disease. Now with the understanding of coronary blood flow, let us try to apply that knowledge to understand the pathophysiology. If the coronary arteries which are supplying the heart tissue, if they get blocked because of either thrombosis or emboli, this will result in reduced blood flow to certain part of the coronary tissue, and when the blood flow to coronary tissue will be impaired, this results in ischemia to that particular tissue and necrosis. This will lead to development of myocardial infarction. What are the common features that is seen in myocardial infarction? Sudden severe chest pain which radiates to left arm and left side of the neck. The severe chest pain is explained mainly because of the accumulation of lactic acid, so which is one of the end product of metabolism, and this will get accumulated because of reduction in the blood supply. So this will result in severe chest pain which often radiates to left arm and left shoulder, shortness of the breath, nausea, vomiting, palpitation and sweating are other common features that is seen in MI patient. What are the common investigations done in MI patient? So commonly done is ECG, which often shows ST segment elevation. Biomarkers which are commonly assessed are troponin IT, creatinine kinase levels, LDH that is lactate dehydrogenase, and serum transaminase. Some of the reasoning questions: why endocardial portion of left ventricle is more prone for myocardial infarction? This is mainly explained because of the phasic blood flow which I already discussed. So the left ventricle receives no blood supply during the systole phase and receives its blood supply only during diastole. This makes the endocardial portion, which is also called as watershed portion of the left ventricle, to be more prone to develop myocardial infarction. Why severe pain is seen in myocardial infarction? We already discussed the answer to this. Now please try to answer which part of the heart is more prone for MI. I hope all of you know the answer to this. Let's discuss still more scenario based questions in the next video. Thanks for careful. Thank you for your careful listening. Thank you so much.